My name is Alicia Krieger with Fort Hays State University, and I will be discussing workplace hazards. What is the definition of a hazard? A hazard is any source of potential damage, harm, or adverse health effects on something or someone. Nurses are exposed to many hazards in the workplace. Several of the workplace hazards in nursing environments are ongoing hazards, such as bloodborne pathogens, radiation exposure, chemical and drug exposure, exposure to infectious disease. A new hazard that has been in the spotlight due to COVID-19 is lack of personal protective equipment. This includes staples to nursing, gloves, gowns, face shields, goggles, and appropriate masks. Although this is currently a hot topic, it is not a new topic. In 1991, OSHA initiated the Bloodborne Pathogen Standard, which included the training and use of PPE that many healthcare workers take for granted today. Other workplace hazards in nursing include sexual harassment. Sexual harassment is high against female nurses. Female nurses are being harassed by patients, patient families, physicians, other nurses, and other coworkers. Nurses are exposed to many types of sexual harassment, including verbal, nonverbal, physical, and psychological. Physical injury, sprains, strains, and other injuries associated with patient handling account for the largest share of workers' compensation claims and costs. Workplace violence. In a study of 1,809 nurses, 74% stated that they had been exposed to workplace violence. In 70% of these cases, no actions were taken, with reasonings as nurses believed it is not important or it is useless to report. Mental or emotional injury can be resulting from high stress levels. Treating trauma patients and caring for terminally ill patients can take an emotional toll on those providing the care for them. What is the prevalence? According to Blake Farmer with NPR, to protect the United States against COVID-19 and accelerate a return to normal, we must ensure the safety of the 18 million plus physicians, nurses, respiratory therapists, and other healthcare workers. More workers were injured in healthcare and social assistance industry sector than any other. In 2017, the healthcare and social assistance industry reported more injury and illness cases than any other private sector. Healthcare and social sector had 582,800 cases. The closest sector to healthcare was manufacturing, at 153,900 cases. New workers are more likely to get injured as a result of their inexperience. Workers in the first month of a job are 4 times more likely to file lost time claim than those with more than 1 year on the job. Registered nurses and nursing aides suffer more injuries than almost any other occupation nationwide. What are the effects of workplace hazards to the organization? Increased cost. Nationwide, workers' compensation losses result in a total annual expense of $2 billion for hospitals. An injury can lead to thousands of dollars in additional cost for overtime, temporary staffing, or in cases of permanent disability, replacement. High turnover rates when injured employees quit, and decreased morale. Decreased productivity and morale as employees become emotionally and physically fatigued. The effects on patients. Patients become more increased risk for falls, which can cause fractures, bruises, or skin tears. Patients are at increased risk for medication errors. Caregiver fatigue, injury, and stress are all linked to a higher risk of medication errors and patient infections. They are at an increased risk of infection. Higher patient-nurse ratios are associated with the patient urinary tract and surgical site infections. The effects on nurses: risk of contracting disease or infection, viruses. Each day without proper protection means the risk of another nurse contracting COVID-19 and no longer being able to provide patient care. Nurses that are under increased stress or lack the proper materials are at risk for making sentinel errors that affect their patients. This could result in disciplinary action against the nursing license and even losing your nursing license. Hazards in the workplace can cause increased anxiety for the nurse. Depression can result from increased exposure to hazards in the workplace. Sexual harassment can affect mental and physical health, including anxiety, depression, sleep disorders, weight gain or loss, and lowered self-esteem. The background of hazards in nursing. Nurses have always been exposed to many hazards in their daily job duties. Nursing began with Florence Nightingale treating soldiers as she moved from camp to camp by the light of her lamp. She was exposed to many hazards during that time. Nurses have historically been known for caring for and treating soldiers during war. In wartime, nurses are exposed to long hours, heavy lifting, bloodborne pathogens, and other hazards. Home calls were the initial form of caring for the sick. Nurses were the frontline providers, exposing themselves to communicable diseases while making house calls. Today's healthcare is provided in hospitals, ambulatory settings, and in the home. Each environment has its own set of hazards the nurses are exposed to. Solutions. Collecting data is a good first step in identifying the strengths and weaknesses of your organization. Some of the safest hospitals are the strongest believers in continual improvement, so they are continuing to fine-tune their systems to prevent even more injuries and illnesses. Training for all healthcare providers is an important aspect in working with the various hazards. Employers are required to have their employees complete annual training on bloodborne pathogens, radiation, chemical, and drug exposure. Many employers provide annual training on sexual harassment and workplace violence as well. Training on proper body mechanics and lifting is important to prevent sprains, strains, and other musculoskeletal injuries. Training empowers nurses to be aware of hazards, how to handle them, and how to respond if an incident occurs. Having the appropriate equipment such as lifts, slide boards, PPE is a step in prevention of nurses becoming injured or contracting illnesses from the patients they're caring for. My organization has developed a PPE grade card that is emailed out daily. It is color-coded and shows how the organization is doing with on-hand supplies of gloves, masks, gowns, and ventilators. This chart also shows percentage of hospital beds that are in use, ICU beds in use, and ventilators in use. This proves the organization's dedication to the staff and making sure that there is adequate PPE on hand to protect the nursing staff. Minimal lift policies help prevent injuries as well. Patient assessment tools are helpful in identifying which type of assistance a patient needs so that staff are adequately prepared before assisting the patient. These can be communicated on the chart, outside the door, by a bracelet on your patient, or on the communication board in the patient's room. Dedicated lift teams. This was a new concept to me. I found it very interesting and can see how this would be beneficial. Lift teams protect a healthcare organization's most valuable resource, the nurse. Appropriately selected and specially trained team members can significantly reduce injuries, improve outcomes, and enhance nursing satisfaction. At Miami Valley Hospital, the facility policy calls for lift team assistance when more than 2 caregivers are needed to safely move a patient. A member of the lift team must pass a firefighter fit test annually, as healthy employees are less likely to get injured. Lift team members carry a wireless phone to be contacted at any time to assist with the following: position changes, positioning patients for tests or procedures, getting patients up for meals, emergency lifts, and helicopter offloads. Data during the first year showed that the lift team freed more than 800 hours of nursing time. They completed 10,070 assists with 5,999 lifts as repositioning in bed. Consequently, this organization showed a decrease in the number of injuries to staff. They reported a 70% reduction in injuries, lost days from work, and associated medical costs. Nurses reported less musculoskeletal discomfort after work, and patients reported feeling safer when moved by the lift team. What's next? See it. Nurses must first realize that even though these hazards are in our job, it does not mean it is okay. We must realize that we do not have to tolerate workplace violence or sexual harassment. Say it. Nurses have to start reporting these instances of workplace violence, sexual harassment, and lack of personal protective equipment. Change it. Nurses must be involved. Be involved in your organization, serve on committees, help with process improvements, policy changes, serve in your community, write to your legislator for policies on sexual harassment, nurse-patient ratios, and workplace violence. Be the positive change for your profession. The next 2 slides are my references you can view. Thank you for your time.